All right, first, I would like to welcome and introduce to all of you Dr. Oscar Mairena from Gilead Sciences. Oscar, if you would, my dear. Two different mics, two different mics.
Yes.
Feel free to tell everybody a little bit about yourself. It should be on for you.
All right. Hi, everyone. So I'm Oscar Mairena. I am with Gilead Sciences Community Engagement and Advocacy Team. We work at the intersection of the community and Gilead, and we try to be that voice internally of all of our community partners while also representing Gilead externally with all of our community partners. So I'm really excited to be here. My portfolio specifically focuses on HIV prevention. So I'm really excited to have that conversation with you all today.
All right, is this one working in the backside now as well? We're hearing it back there. All right. Then if you could pass that down to the lovely, the fabulous Thomas Deem, also from Gilead Sciences. Thomas, tell us a little bit about yourself.
Hi, everyone. So, yeah, I'm Thomas.
Eat that microphone.
I will
bitch.
try to eat the microphone. Okay, so I am the new, actually, Palm Springs HIV Prevention and Treatment Medical Scientist. So I work in our HIV medical division and help educate providers and kind of discuss what's going on, what's new, and provide support for prescribing and other medical questions for our providers here in the area. So I live in Central California, but I'm here visiting, and I'm really excited to be here. Thank you so much for having us.
Fabulous. Thank you for being here. And from our very own DAP Health, Dr. Jason Halperin over there.
Thank you, Rusty. And I see so many familiar faces. I cannot thank everyone enough for being here. This is such an important talk, and I cannot wait to get to the Q&A so we could really get your questions answered. So I'm Dr. Jason Halperin. I'm the Director of Specialty Programs at DAP Health. That means I oversee all of our HIV programming, our STI programming, and our HIV prevention programming. And I specifically oversee our clinics that provide low barrier access to care. We have 3 sexual wellness clinics. Many of you know the Orange Clinic right here in Palm Springs, but we also have a similar clinic called the Stonewall Sexual Wellness Center in Cathedral City. And then we also have our sexual wellness site in Indio. And soon we'll be opening our first San Diego site in Oceanside, California. I work both here in the Valley and in San Diego, providing HIV care specifically and overseeing those services. So I'm very, very thankful for you all to be here and to be with Gilead today to answer any questions.
Thank you, and I much appreciate it. How many of you even knew that there was like another branch of DAP out in Cathedral City and out in Indio? A few of you. So a lot of you did not fucking know. I had no clue. So that's good to know. Thank you for sharing. Already getting good information right out the gate. All right, we're going to get right into it. We've got some fabulous questions all lined up for you. If you feel like you have something important or useful to contribute to the conversation, feel free to grab the mic from whoever's got it and jump in and answer those questions. If all of you want to jump in round robin style, feel free to do that as well. The more information, the better. That's why we're here. The first question, given the current landscape for HIV prevention, what are your top concerns and what are some strategies that you think would be useful to address them? Dr. Halperin, I know you've got one.
So I would say right now we are in an incredible moment of innovation in HIV prevention. I mean, this is really a dream that we've all had to get to the point that we have so many options that I can guarantee prevent HIV. So we have oral medications, we have injectable medications, some that you take every 2 months, newer ones now that are once every 6 months with almost guaranteed HIV prevention, which is everything we've ever wanted in terms of having access to these medications. My biggest concern is the barriers that are being placed by the federal government right now. The number one thing I'm concerned about is the defunding of Medicaid. Medi-Cal is a lifeline for so many of our patients to access HIV treatment and HIV prevention. This is not just in California, but throughout the country. So if there's anything that I feel we should be all fighting for, it's to not defund Medicaid, but to fund Medicaid so that we have as much access to these services as possible.
Right. I think, DAP in particular, but a lot of different organizations, they do a lot of fundraising and a lot of charitable work within our community, but there's only so much funding to go around. And with that being cut on a federal level, it's getting harder and harder for people to access any kind of, healthcare. So I do think that is obviously a huge, huge obstacle. And you guys voting, you guys getting out and speaking out and talking to your representatives is really the only option that we have to kind of fix that. You have something to add, my darling?
Sure. So I think for me, does anyone know what year PrEP was approved? Like how long we've had PrEP? I think I actually heard someone say it. 2012. So for the last 13 years, we've had a prevention option. And still, we have 32,000 new HIV infections every year. That's about 90 new diagnoses every day in the United States. For too many people, HIV is just not something they talk about. The urgency around HIV, it has been lost to a lot of extent. So we still have a lot of work to do to make HIV and HIV prevention relevant to the people who need it most. Because if we look at who's acquiring HIV, it's really disproportionately people of color. So about 38% of new HIV infections are among Black individuals. About 34% are among Latino individuals. But then if you look at who's on PrEP, only 14% of PrEP users are Black and only 18% of PrEP users are Latino. So we're missing the mark on who needs to be on PrEP and who should have the conversation with their providers about PrEP. And too many people just don't see that as an option for them or don't see it relevant to their life. And I think that's where we really need to focus a lot of our energy if we're going to get to the end of the epidemic.
I agree. I think in this day and age too, I think you made a really good point about it not having the urgency that it once did. And I think everybody's just so accustomed to all of these different prevention methods being out there and taking for granted when they're on hookup apps or out of the club. Oh, I'm on this, I'm on that. Okay, good. Are they really? Do you know that? And that's obviously, at least in part, where new infections are coming from. And so it is still super important to have those conversations and to know status and to know what is going on and who you're, partnering up with and what's going on there. Did you have anything you'd like to add as well, Thomas?
I mean, just kind of in response to what Dr. Halperin was mentioning, I think, it's critical to show up for our community and to be there for those who can't show up for themselves. And so when I look around and see how many people are here, when I spent the day traveling around Palm Springs, I was so impressed by the number of free clinics and free services and things that are available for people here. In my role for Central California, I go to the Central Valley, Salinas, Fresno, Bakersfield. And if we're going to end the epidemic everywhere for everyone, we all have to do our part. And I think that it's really encouraging to see how much support there is here, but to continue to support how and when you can. And I think that's important. Again, HIV, the epidemic is still with us. We've come a long way, but we have a long way to go. We have some headwinds right now, for sure. But these aren't things that can't be overcome. We've overcome them before, and we're going to overcome them again.
Absolutely. And kind of tying it back into what you were just saying moments ago, as individuals who work with providers, what are the growth areas for providers to ensure more individuals who can benefit from prevention are able to access it? What are some ways that we can help improve that access?
10 plus years, right? I mean, Oscar just mentioned we're over a decade after when PrEP first came out. And HIV prevention is primary care. We love our HIV specialists. I'm one myself, but we don't need them for HIV prevention for the most part. Every primary care provider here in Palm Springs should be able to offer PrEP to their patients when they ask or when they don't ask, but come in with an sexually transmitted infection, talk to us about, their concerns and their relationships. These are opportunities that we've just been kind of knocking on the door of primary care, and we haven't seemed to open that door yet. And so I'm curious to know what my other panelists think about that and how we can do that better.
I agree. I think in a lot of cases, not DAP notwithstanding, because I think the connection between the physicians and the patients in an organization like that are so much more interconnected and personal than, let's say going to just a, HMO doctor somewhere, anywhere else. You don't go in and be like, girl, I got gangbang last night. You're not having those conversations with a doctor that you don't know like that, and you don't know how they're going to react to a conversation like that. But I do think those interpersonal relationships are super important. So the doctor has the knowledge of this person is very sexually active or whatever, having multiple partners. Maybe we should discuss these options. You know what I mean? Like, because why would the doctor think of it if you're not presenting that? But you're not presenting that because you don't know how the doctor's going to react to that. So I think part of that is working on building those relationships with the physicians and their patients. You have something you wanted to add to?
I mean, I could not agree more. I think that it is a real failure of our medical education that HIV prevention is not core to how we are trained. I'm sitting among so many educated HIV prevention specialists. All of you, you're here, you're coming out, you're aware. When you actually speak to primary care clinicians throughout this country, there are very few that are leaning in to initiating PrEP, and it is heartbreaking. The first step is HIV testing. We need universal HIV testing throughout all of our primary care systems. That is a grade A recommendation that we should be following. It's also a grade A. There's the USPTF. I'm very strongly in favor of the USPTF. Let's hope that it continues. But it's a grade A recommendation to provide PrEP, or at least ask someone if they would be at risk for HIV to initiate PrEP. So these are we really need a cultural change where primary care owns HIV prevention. And I'm very happy that DAP is a model, and we need to expand that model. We need to constantly look inward as well and make sure we're doing everything possible so that we are providing the highest quality. But I do believe that DAP is a real example of how sexual wellness is healthcare, and we need to ensure that that's core to all primary care.
Yeah, I mean, I think one thing that HIV's, well, not one thing, you do a lot of great things, but one area where HIV specialists are really good at is having those conversations about sexual health in a way that's non-judgmental, that you can go in and say, what your last night was about. I'm still at work, right? So and have that conversation and be able to share that with your HIV with HIV experienced clinicians. I think we have a long way to go to get the rest of primary care at that level of cultural humility, because part of the problem is that often folks are very stigmatizing in the way that they approach these conversations. And I think there's another part that I wanted to mention here is we've done a really good job with HIV testing. We have improved. There's still a lot of folks that don't know their status, but we have improved that a lot over the last several years. I think CDC's figure is like 3.4 million HIV tests a year. That's 3.4 million opportunities to talk about PrEP at some point, unless they're already on it, or they're one of the 32,000 people who are diagnosed in that year. So 3.4 million encounters.
Right, the door's already open. Have that conversation.
Exactly, but that linkage isn't being made. So HIV testing is great and important, but it's not alone. It's not HIV prevention.
You got to go one step further.
You have to go further, and so we have to evolve that conversation and keep that momentum going, because that's an opportunity. I think we have a lot to learn, and I really appreciate your comments around options, because we have to normalize it the way that we've normalized birth control or reproductive health, right? We have options. People have options in that space, and they get to talk to any provider about it. We're not there yet with HIV prevention, but hopefully we will get there. And I think we have a lot of work to do to make providers more culturally humble and aware to be able to do that.
True. I mean, girl, I mean, look, they do in commercials all the time. I'm sure y'all have seen them, like, do a at-home stool sample if you're over 40. They know that that's something that needs to be checked. They know that that's something that needs to be done, and they're being proactive about it. It's not any different than to say you're a sexually active male or female, whatever, you should be tested and possibly getting on some preventative medications while we're at it. Because I think you made a brilliant point. Like, once that door is open, it is awkward. It's awkward as fuck to sit there and have that conversation and say, you know, hey, I'd like to be on PrEP because I really like to sleep around. You know, you don't want to do that, but you have that built-in icebreaker. Just follow through, take it all the way through. Something you want to add?
Yeah, and just to add to that, you know, we do a pretty good job giving people cholesterol medicine to prevent a stroke. The people with asthma, we have inhalers to help us not have an asthma attack. We're doing prevention in so many different arenas of healthcare. We need to break down the walls when it comes to HIV and sexual health stigma to realize that these are just other health conditions. Sex is a part of life. Sex is a part of being healthy and happy, just like not having a heart attack is. And we should be able to protect, you know, everyone in the way that they want to protect themselves.
Agreed. And aside from your point of kind of having it be like institutionalized testing, this is just something that's standard part of your yearly physical that we do, or whatever the case may be. Do any of you have any other kind of tips on how people may be able to better engage with their healthcare provider relating to their sexual wellness?
You know, I think that I don't want to put that onus on the patient. Like, I feel that there needs to be a change of culture in the healthcare system where sexual wellness is core to a healthy living. And that said, you are all going to be in positions where you are going to need to advocate for yourselves. And I think taking a moment when you're with a provider who is not aware can be really beneficial. My recommendation is, unfortunately, to do it humbly in a way where you're educating the provider, but kind of educating as a partner. Like, and I've seen this really well with urologists. I had multiple times where urology was very unsure why someone was on PrEP, and having my patient say, you know, I need to talk to you so you understand why this is leading. This is a healthy decision for me. And that's important. I want you to know why I'm making this healthy decision.
Yeah, you're not coming at it as the doctor doesn't know what he's doing. You're coming at it as, I need you to understand why this is important to me.
But I also, I don't feel like that onus should be on the patient. We need to do more culturally. We need to do more to destigmatize the fact that we have, that people are sexually active. And we have great example with oral contraceptives. I mean, because I'm a total nerd, I've read amazing editorials that came out in the early 1980s in JAMA and New England Journal of Medicine when oral contraceptives first came out. Because at that point, there was this question, well, if someone gets a sexually transmitted infection, we shouldn't give them oral contraceptives. And there are these amazing editorials in JAMA saying, how dare you question that a woman should have access to medication that ensures that they could have a full sexual life. And we've had these conversations decades ago. It is the same thing with PrEP. I really think that oral contraceptives are the model for us in the way that we need to be destigmatizing access to PrEP.
I agree. It's the same thing. It's just, instead of preventing pregnancy, we're preventing transmission. It's no different other than that. It really isn't. So how, in this landscape you brought up with like federal cutbacks and everything else going on, how do we innovate in HIV prevention given what's going on in the world with our current landscape?
Well, I'll talk from a DAP standpoint, and then I really want to hear a Gilead standpoint. I think for us, a silver lining has been that we have really developed much stronger relationships with sister federally qualified health centers that are doing the same work that we are doing. And I have to thank Gilead because we had a amazing meeting that Gilead supported, where a bunch of these FQHCs actually came together to talk about long-acting injectables, but also then at dinner talking about how are we going to work together. And it has been very, very inspiring to develop these consortiums where we're talking about sharing resources and that we are committing to collective action. And I think at this moment, that is more important than anything else, is to recognize that we are not alone. We are in this with others, but we need to link arms with others very strongly and commit to that work together. And that has been happening in terms of the FQHC space, and I've been really inspired by it.
All right, Gilead.
Well, I mean, to that point, I think that really, it's all about community. Like, community is what's gonna get us through the.
It always has, and it always will.
Exactly. This, I think many folks, Harold Phillips from the NMAC, he has been, his rallying cry has been that these are not the darkest days of HIV. And that is very true in a lot of different ways. It is a dark time, and our communities have withstood a lot in the past, and we're going to continue to keep up with that fight. And I think we are here to be a partner to make sure that HIV is still a priority nationally, that we're working with FQHCs, with folks who are at the forefront of combating the epidemic, of diagnosing people living with HIV, of preventing and prescribing HIV, PrEP for prevention of HIV. So that those partnerships aren't going away. I think for us, it's really about continuing to center the folks that we need to be centering and having the discussions like these in the right rooms. I think, when we're talking about, and I think it's some of the other questions, but I think really this is the room that helps us get that message out. Providers, it's not, the onus is not on individuals and on patients, but it is a little bit on community to help educate each other. Like, if you have that friend that should be on PrEP and isn't doing it and isn't having that conversation, or has some myths that need busting, then, help us out with that, because I think that peer-to-peer is really where a lot of that change is done. Obviously, I'm not avoiding that part, but I think I just can't avoid, or I can't stress enough how important community is right now, because we need each other.
No, I mean, I completely agree. We all have that one friend that we know is that girl. She out doing the streets, and she should be on PrEP, and for whatever medication, and for whatever reason, whether well, I don't have a job, I can't afford it, I can't do this, I don't have insurance, I don't have that, whatever their excuse is, I don't want to, it scares me, whatever it is. You refer them to some of these resources that we have, like DAP, Gilead, and other places, and let them know, girl, they got you. There's programs to help you. There's programs to cover you. Go down there, find out what you can do, and then you actually know what you're dealing with, and you can move forward from there. Thomas, did you have anything you wanted to add, my dear?
I don't think so. I don't have anything. That was a lot.
That was it. Done. Well, Thomas, my dear, what current HIV prevention strategies get you all excited?
Oh, gosh. So long-acting injectables, of course. There's a lot on the table right now, a lot of different options. I think for the first time, we've had so many options.
And the long-acting injectables, you mean the ones that we only have to take a few times a year, right?
So you get a choice, a couple months, a couple times a year. Oral medications are still available and there, and more to come in the future as timelines continue to stretch. Shorter, longer, you've got options. If you want to take a pill every day, that's available. If you want to receive an injectable, that's also available. So I think tailoring those options and choice is a
girl, because I forgot what I came into the room for. As I get to the room, trying to get me to take a pill every damn day is like pulling teeth. So being able to go in a couple times a year or a few times a year that's a good option for me. That's a good option for me. You want to add?
Yeah, I mean, just to add to that point, I think what's most exciting about that to me is that, like I said, 2012, we've had PrEP for a long time. A lot of people haven't seen PrEP as an option for them. They may have concerns about privacy and where the pills are stored, or if someone's going to see them, or if they live with parents. It's a whole conversation that they may not be ready to have. You know, for other folks, it might just be that they don't like taking a pill every day.
Yeah.
Or that there's some amount of this that is just a reminder that they don't want to have a reminder of. And so I think for so many folks that didn't see PrEP as an option over the last 13 years, to your point, there's multiple oral options. There are multiple injectable options. There's daily, bi-monthly, biannual. Like that is a different environment that we're talking about. And I think looking at, the next gen, this is the next generation. That is where we're going. And I'm only more hopeful about what's to come, because hopefully folks that we have been missing start to come in because they see this as an option for them.
I mean, I'll just echo that it's just incredible how far we've come. And DAP has free sexual wellness clinics where we are committed to providing all of the PrEP options for whatever a patient desires. And I could not stress enough that some patients want a pill because it's easier if they're going to spend a few months here and then 9 months somewhere else and they're traveling. And then I have patients that cannot believe we are going to have an injectable that's twice a year. As one of my patients said, that's like a vaccine almost.
It's close.
So
It feels that way.
we are at a point that none of us ever thought. I didn't think we would be at this point 12 years ago when Truvada first came out as
In our lifetime, for some of us.
yeah. And I believe we're only going to see more. When we talk about next gen, we don't even know what's coming, but you can see that how far we've already come in those 12 years. I think the science is moving at an astronomical speed. Yeah. But the destigmatization is not moving at that same pace, and ensuring equity is not moving at that same pace. So we have to really commit to
Balancing those scales. Yeah, absolutely. Oscar, I did want to ask you, because you brought up next gen. When you hear next gen prevention, what comes to mind?
I think just kind of going back a little bit to what I started to say, I think to me, next gen prevention is just about a complete evolution and almost revolution to the way we think about PrEP. We, for too long, have censored risk when we're talking about PrEP, and we're not censoring pleasure. We're not censoring the fact that for many people, that risk conversation is kind of scary and it's not very sexy. But if we're talking like PrEP, what's so great about prevention and in the HIV space is that these are folks that are otherwise probably not going to go to the doctor. We're getting people in to see their providers quarterly for STI testing, quarterly for HIV, for refills, for whatever it is, depending on the medication. These are we're promoting overall wellness, and I think that's the part where the next gen is moving away from this risk-based conversation to more of that. HIV prevention is just part of overall wellness, and I think that a lot of the innovation that we're seeing helps us get to that, to the point about the contraception examples. It's just, we're gonna get there. I'm pretty hopeful about it. It's not there now, and I want to. One thing that I'm constantly saying is, like, we have more options, but the healthcare infrastructure hasn't changed, right? So and medical distrust hasn't changed, and the folks who aren't going to the doctor aren't magically going to start going to the doctor. So we still have a lot of work to do upstream, but I think that the options are there once folks are engaged, and we have to bring them along that upstream.
Well, I'd love to see how excited you are by next gen coming in. And this kind of applies to all of you, but How do you bring that kind of energy, that excitement into the work that you do, whether it's in the clinic, in the lab, in the community, whatever it is? How do you bring that excitement for next gen care into what you do?
I think, in my capacity, I work with healthcare providers on a daily basis. And I remind them that PrEP is for all bodies, all people, all genders, all sexual orientations. It's there to protect anybody who's sexually active. And I think that that is an important message because I think providers have a certain tunnel vision at times where they think about who is the ideal PrEP candidate. And that's shifted. The next generation of PrEP is that PrEP is for everyone, no matter who you are, where you come from, or where you want to be. So I think that that's what I think about in my work is and also to continue the excitement. I was there when PrEP first came out, and I hope to be there when there are no new HIV infections. And we have the tools to get there, and it's just about putting those tools into people's hands, specifically in my role, into providers' hands, but also being a part of the community and my friends, my family, and all of my circles. And that's what keeps me going each day.
I love that. Dr. Halperin?
Enthusiasm is, this is the greatest gift of my life to do this work. I mean, I lost a very good family friend when I was 9 years old to the epidemic. And I remember at that moment being at his funeral thinking, all I want to do is HIV work. I thought I would be doing hospice medicine. That's really what I expected.
That was really the only option at that point in time.
And, it was a short time thereafter that I got to be working in clinics where I get to tell people, you're going to live as long a life. And then shortly thereafter, I got to say, and once you're undetectable, you cannot transmit the virus to anyone. And that had such a power to ending stigma. And it ensured that I would just literally watch people sit up in their chair as if something was lifted off their shoulders, because most of my patients living with HIV, their number one concern was transmitting the virus. Yep. So the U equals U message. And then we have HIV prevention. We have, as Thomas mentioned, every single tool to end the epidemic. And we have incredible medicines to support those living with HIV, to live a full, thriving life. Yeah. So it is an incredible time to be doing this work. The heartbreaking side of that is we still have these inequities and disparities. And how do we bring this level of energy to overcome those?
Exactly.
Yeah, I think for a long time within HIV has been within HIV specialty care. It's been treated differently, right? It's been it's special in the way that
it's the little stepchild, it gets treated differently.
It's an exceptional. That's the word. I thank you. It's been exceptionalized in a lot of ways, and I think some of the challenge has been that to do that we have to despecialize it, right? We have to make it mainstream, and I think a lot is lost in that because, and I think some of the urgency comments that I made earlier, I think that's some of the concern. But I think going back to the question, the part that's exciting is that we get an opportunity right now to carry this message to new places and to spaces that we haven't been in and to communities. We can't get to the end of the epidemic if we're only in a room like this. We have to go to rooms that look very different and to community groups and organizations that do not even know that HIV is still a thing. And I think
we can't just preach to our own choir.
Exactly.
We got to get out.
It can't be that way. And so I think that's what's most exciting for me right now, that we've always had that responsibility and opportunity, but right now I think is really a pivotal moment to do that with such new information. I think it's giving us a moment to pivot a little bit, because I think the word PrEP has been associated with a specific community, and right now we have a chance to completely change that up, and it's a paradigm shift that I'm excited to challenge.
Absolutely. And I know you also brought up earlier, Oscar, the the problem with access, especially for people of minorities, people in rural areas, all of that kind of stuff, just makes it exponentially more difficult to access care. What are some of the strategies to make sure that these next gen HIV prevention tools aren't just talked about, but actually reaches the people who need it the most? What does real equity and community engagement look like for you, especially for our Black, Brown, trans, and non-binary communities?
Yeah, I mean, first we have to reach them. I think we have to find the right messengers because, you know, I might upset some of my colleagues, but Gilead is not always going to be the right messenger for that. A pharmaceutical company is not always going to reach the people that we want to reach. We need community partners to do that. We need people with lived experience. We need it to be peer to peer as well. And so I think we have to go into those spaces, have those conversations. I think on the access piece, I think one thing that I'm really kind of tapped into right now, and it's just really in my mind, is that a lot of folks don't think that PrEP is accessible to them without ever having a conversation with their provider or without ever seeing if their own insurance coverage will cover it.
But then you have organizations like yours where it's like, you come in, we'll deal with that part of it. You know what I mean?
Right. So DAP and others, but then the you know, pharmaceutical companies also have programs that provide assistance. And so there are so many different ways to access PrEP. And I think, unfortunately, a lot of times people don't see it as an option for them and don't even have that conversation. They self-disqualify almost. And I think we have to challenge that a bit. You know, have been having a lot more of those conversations, even with friends. Are like, I don't know if I can be on it. Why not? And then we find out they actually do get coverage.
Right.
Or if they have a copay, they can access a copay support program, or they can go to another clinic where they can get the medication. So there are so many different ways to access right now. I think there's true barriers to access. I'm not minimizing those, and I think we have to work on them. And we also have to make sure that folks are actually having those conversations for themselves,
Right.
because it ultimately is an individual. It's a person by person, insurance by insurance, uninsured status by.
But also letting them know if they're really uncomfortable having that conversation with their primary care in some little
Right.
one-horse town, there are ways around that.
Correct. Yeah.
I think that's
depending
huge.
on the medication and the program, but then also organizations like DAP and others that are there to offer that type of navigation and support.
Agreed. Dr. Halperin, I know this one, I think, kind of falls right in your category. When you think about the future of HIV prevention, like 5-10 years in the future, what gives you hope? What breakthroughs or big shifts do you see on the horizon that'll really change the game in our community?
Yeah, I mean, I think that we've really focused on the medical interventions, and I know 5 years from now we're going to be looking and potentially seeing things like once every year, once every 2 years, maybe, we're looking at the potential for longer and longer acting medications. That, to me, though, and I keep saying the same thing, like, that's not enough, right? Medical innovation is not enough. We need to overcome the disparities. And to me, what I would really hope, I think it's going to be tough. We're probably going to have a little pause with this administration, but maybe thereafter, I would love to see where you could access PrEP in so many different capacities, where it would be so easy to access PrEP.
Right, like, we have, DAP provided that
was
that
just
drug
gonna
thing in the back, the vending machine. We need PrEP to be that accessible. You walk in and be like, girl, I need to take my pill today.
You stole the words out of my mouth. We have the Hunters vending machine. We should have PrEP in the vending machines. Like, that would be the dream. And it's possible. There are examples of this in other countries now, where community health workers are providing the medication, where they're doing a rapid test and immediately providing medication. Less with PrEP. I think that's coming, but for HIV treatment. So we have models that really decentralize access. And we really need to be getting care to people in ways where they don't have to walk through they have to walk through a medical clinic where they might not feel supported. And we need to think about how we decentralize this for access.
Absolutely. Thomas, what gets you super excited when you think about HIV prevention
Well,
going
kind of
forward?
very much what Dr. Halpin was just mentioning is getting healthcare outside of the four walls of the clinic. We need to bring the clinic to the community. For the longest time, we've asked the community to come to the clinic. And this is where we are, and this is where we'll continue to be unless we change something. So, part of my work with healthcare providers is thinking outside of the front desk of their clinic, getting into a van, doing street medicine. During COVID in Denver, we worked on nail salons, and you would come in and you get a vax and a wax. I mean, so
Girl, where
thinking-
was my invite? Girl.
thinking about those kinds of examples, those kinds of things, the everyday things that we do, HIV prevention should be a part of that. And it shouldn't be so difficult to get into the clinic, find a parking spot, go to the 5th floor, navigate yourself to this counter, talk to this person that may or may not treat you well, and then you just leave. So we need to get past all of that and start thinking about, the clinic that's in the back there.
Agreed, 100%. Oscar, anything you want to add, my dear? It's like, no, I'm good. All right, well, this one I want each and every one of you to give me an answer on, and that is this. If you could leave the attendees that came here to join us tonight with one final thought to continue to fight and advocate on behalf of those who can benefit from prevention, what would that final thought be for you?
I'll just go left to right. So mine, the medical scientist, I would say believe in science. Science is under attack right now. The concept of science, which I never thought in my lifetime.
Not the concepts of science.
Right? Even just like what it is and if it's real. I mean, it's real. It's gotten us to this point in the epidemic, and it's going to get us out of the epidemic with science and community together. But we have to have both parts. And if we let one of them completely dwindle away, we won't be able to get any farther to all these innovations and breakthroughs and everything we've been talking about tonight. So believe.
Agreed. And before you get to that answer, if we could have our lovely gentlemen in pretty much no clothing, our lovely go-go boys, if you could go around and collect those questions that we had, little sheets, little postcards that we gave to everybody, where they could write down any question that they wanted to ask our panel tonight. Go ahead and collect those at this time and bring them on up to me once you've got them all collected while we finish out some final thoughts up here. Thank you, my darlings. Dr. Halperin, go ahead. What is your final thought?
So I would say from the DAP side, I want, and you're here and you know this, we are here. Like, we are part of this community. We welcome anyone interested in HIV care, HIV prevention, sexual wellness. This is our red carpet is out for our community here. That's the DAP side. For me, I mentioned it before, expansion of Medicaid did more in terms of ensuring equity in this country than anything else we could have done. We could sit here and talk on and on about our commitment to equity and overcoming disparities. Expansion of Medicaid has done more than anything else. So if we're committed to this, we need to really fight to ensure that Medicaid is not taken away. We know it's being brought back. And especially when we think about how lucky we are in California, we need to be making those connections with people throughout this country, especially where it's more difficult to access healthcare, and really fighting for expanded Medicaid there. I think that is the most important thing we could do as a engaged community committed to this work.
Fabulous. Dr. Mairena?
Wow. I didn't think I'd have. Well, I guess there's more questions, so it won't be the last word. Good, because the pressure's on. No, I mean, I think for me, it's really just this urgency piece that I think I would love for this room to walk away and have that in their mind, that the urgency around HIV prevention is still there, is still needed. And if everyone in this room talks to 3 people about how HIV is still a thing right now, and then they also talk to 2 people about getting tested, and then they talk to 1 person about getting on PrEP, that's the type of community-led mobilization that we need to get to the end of the epidemic. So I really think that we just can't do it without community partners and without the community itself. and just we need to continue to stress that urgency around HIV prevention.
Perfect. Thank you so much, gentlemen. I greatly appreciate your time and your wisdom giving out to everybody today. We do have some questions from the audience. God help you. We never know what these are going to be. So feel free to answer them as openly and honestly as you seem fit. And this first one, it says, it seems young people are testing positive more frequently. How do we reach the younger demographics specifically for HIV prevention? Any of you? You said age before beauty, bitch.
In my case, both. No, I think no, that's absolutely true. So we do see higher diagnoses and lower uptake of PrEP among younger folks, and we're missing folks. I think it's really interesting. Again, we've been doing a lot of the same for a long time, and that needs to change. And I think the nothing for us without us type of mentality is where we have to lean in. We have to engage with young people. We have to learn from younger folks about what's the best way to reach them with this message, and have them also carry that message. I think often we can be pretty condescending to young people about not, knowing their history and all of that around HIV. And I don't think that helps. So I think it's about figuring out how to empower young people with the information so that they can carry that message.
Yeah, you don't want to come at them like a parent scolding them. That's not the right message.
Well, and I think to add to that, reaching young people where they're at. Young people want the next big thing. They want the newest iPhone or whatever.
So get a Kardashian to sponsor it, or
right. I mean, thinking
saying?
about people that are kind of hip and new and on the social. Like, I'm not very good at Instagram and all that stuff. I was the Facebook generation,
Same.
showing my age. But I think, MySpace. Wow.
Don't make me take you out of my top 8.
But I think people also like things that work, and they work well. And PrEP is incredibly effective when you take it or go in and get your shot. And it's like 99.9% effective. Guess what also works really well? Like GLP-1s, Ozempic, and Zepbound. Everyone wants to be skinny. So why don't we take analogies from other areas of health that work incredibly well?
So we just need to do a cocktail that does HIV prevention and makes you skinny, bitch. Well, I'll take it.
I mean, I'm just saying they're all shots.
True. I mean, you can take one shot in the ass a day. You can take 2.
People take shots on Sundays.
And Fridays and Saturdays.
I'll add a quick thing. There's some really good data on the medical, what young people. So this was looking at people under 30, and they asked them what would they want in a medical clinic. And I thought it was very interesting. It was exactly flipped from that of those over 60. So they wanted hours where they could walk in. They do not want to see the same provider. The same provider is not important. Way more important is accessibility.
Older folks want that consistency. Younger folks just want availability.
So I really believe that this kind of low barrier model, walk-in access is really, really essential. And also thinking about that decentralization. So having a pop-up clinic, outside, in areas that feel more comfortable to young people. There's been a lot of success there. So I think there are models. We need to do more. We need to engage young people. We need to ask them what they want and follow their lead.
So we'll see you at the pop-up clinic at the Starbucks during fall for pumpkin spice latte season. We'll see you there. All right, 2 questions here, both kind of along the same line. So I'm going to read both of them to you, and you can kind of answer one or both. One person was wanting to know, if I miss my dosing window, do I need to restart? And along the same line, somebody else said, I take PrEP daily, but if I'm anticipating not being sexually active for a month or 2 due to travel or illness or whatever, is it okay to stop taking it and then restart a week before I know I'm going to become sexually active again?
Either of the providers.
Okay, so someone asked about missing the dosing window. I don't know if this is specific to the injectables. I assume so. Each of them has different options. So there's for the injectable, that's every 2 months. First you get it, then you get it 4 weeks later, and then it's every 8 weeks. And you really want to be within that dosing window of a +7 days afterwards. If not, if it's up to 4 weeks, we have a conversation, we make a decision together. With the newer injectable, that's going to be every 26 weeks. It has a ±2 weeks. Correct me if I'm wrong. What I'm really excited about is if you have a plan to not take the medication, you could take a once weekly pill and then just continue. So if a lot of people here say to me, you know what, I'm going to be traveling. Well, if we could then keep them on that once weekly pill, then we could just restart the injection without any difficulty. So that's exciting. Up to 6 months. Thank you.
So essentially, they do still need some continuing care
So they
to keep it going. They shouldn't just stop altogether and then come back after a month or two and be like, let's start all over again.
So I don't know. The beauty about PrEP is it's not HIV treatment, right? PrEP is for prevention. I think everyone should be able to make those decisions for themselves if they are going through a time of risk and they're committed to PrEP. But
I think the question's really like, is that safe? Is that still leaving me in a preventable state? If I do stop altogether for a full month and then say, hey, next week, I'm ready to get back into the swing of things, so I'm going to start taking my pill again now.
Right. So there would need to be, so we wouldn't recommend a discontinuation and then a start like that. But I do talk to my patients often, and I have some patients that are like, oh, you know what? I'm now in a monogamous relationship, but I think that in 3 months, or I know in 3 months, we're planning to go to Europe and we're going to open that relationship. Well, you know what? That's fine to restart PrEP before that travel. Like, people should own that decision. There's also the 2-1-1 dosing, which is a nice way where if someone is having less, if there's a risk that's a little less, they could take 2 pills and then one 24 hours and one 48 hours. Anyway, we go over all of this, but there are so much innovation in the PrEP space. But I would never want someone to think once they start PrEP, they have to be on PrEP forever. It should be a decision driven by the patient,
right,
on when they should be on PrEP. And that's
But if you're expecting a short-term stoppage, then it's more a matter of maintenance than it is stopping altogether.
absolutely
Perfect. I think that should be clear enough for everybody out there. They do want to know, like, with all of these things coming out where people can go longer without, in between treatments, between injections, I'm assuming specifically, do they still need to get tested for STIs every 3 months?
I think testing in general is something that you need to speak with your provider about. We have PrEP patients that come in every time they have sex. And we have PrEP patients that want to come in every 3 months that coincides with their oral testing. Each injectable has recommended HIV testing guidelines, and oral medication does as well. And so as things progress and get longer and longer, there's a lot more flexibility around HIV testing, but it's really important to talk with your provider about what that means to you, what you're comfortable with, and what's kind of the minimums that are required, to safely prescribe your PrEP and make sure that if you are acquiring HIV for whatever reason, you went off your PrEP, that we make sure that we test and get you onto a full treatment as soon as possible.
All right, we've only got a couple of minutes left.
I just want to add
Go
one thing.
go for it. Go for it.
We do recommend at DAP. We're still recommending every 3-month STI testing. We're at a higher risk here, and there is DoxyPep. We are very committed to DoxyPep. So it's 2 tablets of doxycycline after sex reduces the risk of chlamydia and syphilis by 50%. Not gonorrhea, and still 50%, not 100%. So we still recommend STI testing, but all of our patients on PrEP, we recommend DoxyPep. And even those who might choose DoxyPep and not PrEP, we don't love those decisions, but it happens. We are really committed at DAP to ensuring DoxyPep is available.
All right. Thank you very much, my dear. One of the things, I have 2 questions, and I'm going to kind of try to get through these as quickly as we can because we are pretty much out of time. But somebody did have one I think is very important. They want to know if you see the cost of injectables coming down in the future, because even with good insurance, they found them to be exorbitantly expensive.
Yeah, so I mean, I think the biggest part here is, again, every individual is going to have different coverage. So it's really about who your insurance provider is, if you have insurance, and what they cover. There are a number of programs out there. Obviously, this is not about a specific product, but there are programs out there for those who have copays to support with the copay side of it if you're insured. If you are uninsured, there's also patient assistance programs that are out there for people who are eligible so that they're still able to access the medication. So affordability is definitely an area that's a priority, and we want to make sure that people who need PrEP are able to access it. And each innovation requires an investment for the next innovation. And so I think that's really important too, that we've gotten here, like lenacapavir, which is the medication that was recently approved, took about 12 plus years of study. That's a lot of investment and time. So with any next medication that comes, we are investing. We have a number of different studies that are out there right now in prevention as well. And so there's always that investment that we're trying to make.
Absolutely. And then the final question we had was somebody was wanting to know. They said they know that certain medications are known to be hard on the kidneys and kidney function. For someone who takes multiple meds daily, such as antidepressants, which are already taxing on the kidneys, adding PrEP or something like that to the mix can seem worrisome, and they're wondering about any kind of drug interactions along those lines.
So you should always talk with your healthcare provider and discuss all of the medications you're taking, prescribed or non-prescribed. So thinking about creatine, herbal supplements, other things that we don't think of, ibuprofen, Tylenol, over-the-counter medications, all of that's really important to talk with your healthcare provider about, not only for what it the effects of those medications on your organs and organ systems, but also the interactions between the medications themselves. One thing that differentiates injectables from oral medications is that some of the guidelines around monitoring some of these organ systems are different and not necessary in some cases. And so as we continue to refine our HIV medications, HIV prevention medications, we're finding with each new next generation of drugs, we see better safety profiles, less impact on organ systems, and the ability to kind of even avoid some of those with injectables as well. So.
Perfect. Thank you so much. Anything else any of you want to add?
I was just going to say, we have so many options right now that there is no patient I cannot start on PrEP. There is every single patient out there, there is a PrEP option for them.
Perfect. Good to know. Boys and girls, ladies and gentlemen, and everyone in the room with us tonight, I want to thank you all for being here. Please give it up for our fabulous panel, Dr. Oscar Mairena, Thomas Deem, and Dr. Jason Halperin. Thank you so much for being here, gentlemen. We greatly appreciate you. Also to Michael Malfavon and DAP for helping put all this together for everybody today. Hunters for hosting us here. And as always, I am the bitch with the big mouth. My name is Miss Rusty Waters. Thank you for being here. We'll see you next time. Until then, bye, bitches.